one. SABC News reminding us that the Justice Department has said its latest statistics show an increase in statutory rape cases during the 2025 to 26 financial year. The number of reported cases rose from 127 in the previous year to 199, and there is a growing concern involving child offenders. 22 minors reported for statutory rape, 890 implicated in rape cases. These are children, essentially, who have taken advantage, raped young girls, and they're facing a criminal prosecution of one kind or another because of it. At the same time, Love Life is reporting that the number of teenage pregnancies is continuing to rise in South Africa. It's quoting the South African Medical Journal, which shows that girls in rural areas are particularly affected. So we've asked two experts to come in on this. Shaheda Omar, Clinic Director at the Teddy Bear Foundation, joins us, as does Pelisa Mashi, social worker at the Callus Foundation. And I thank you both so much for your time on the Daily Discourse this morning. Dr. Omar, I'm going to start with you. On the face of it, there appear to be so many interventions to intervene in terms of statutory rape cases as well as teenage pregnancies. Why are we seeing the rate of both of these groups growing?
Well, I think if we just look at the landscape of our justice system and, of course, the reporting and response to the reports that are made. Firstly, we know with statutory rape, a lot of the perpetrators are known to the family. Either it's family members, friends, some or other relation that is connected to the child. And then we also find that within the educational institutions, there are educators or other supporting staff that have been instrumental in impregnating learners. So the learners, if you look at the dynamic of power here, the learners are in a position where they are helpless, hopeless, and often there's intimidation, coercion, but also compensation. If you mentioned the rural areas, and I want to focus and hone in on that specifically because we find that they use traditional leaders or they use their cultural norms where compensation is then provided to the family and no further pursuit of justice or recourse or any consequences are actually put into place. So what we are seeing, we're still seeing a tip of the iceberg. It's under-frequently reported, it's under-reported and under-frequently reported. And often we find that victims are not comfortable or confident to come forward because it's just the response of the justice system where often the systems are failing our victims. Opening a criminal case means that it could take anything between 2 to 6 years, recurrent visits to the courtroom only to be informed that there's postponements for various reasons. So failing the child and, of course, subjecting the child to secondary victimization and harm. There are many other underlying factors that we could unpack, but I'm just giving a broad overview of the challenges that victims have to face and how families actually address the issue of statutory rape. And then I think one more thing, Joanne.
Yes, Dr.
If we just look at child-on-child sexual abuse, the increased incidence, again, because of, I think, there isn't consistency in the way our laws are managing it, the consequence management, where people are actually getting away with it. And, less than 50% of sexual offenses that are committed against other children are by children themselves. So it's, attempted penetration, and all forms of sexual violation. And we know there's a systemic lens that we need to bring into perspective. It's adversities, history of victimization, domestic violence, chronic exposure to sexual abuse material. There are numerous factors that are, contributing to this harmful sexual behavior, because we get your typical sexual behavior, which is age appropriate and expected developmentally for that age group. But then you find there's problematic sexual behavior where the red flag goes on, and often those are not actually identified and attended to, and then, of course, it results in what we are seeing now, the harmful sexual behavior, where we find the outcome is a pregnancy, as we saw last week, a 13-year-old being impregnated by another boy, a family relation of 14 years. So these are the harsh realities, unfortunately, that we are faced with.
Yes,
Thank you.
Yeah. Ms. Mashi, I want to bring you in here because I think Dr. Omar is drawing an important distinction here. There are older men who are clearly raping girls, right? They're raping teenage girls. What for me, and I'm asking this out of interest and ignorance, the other relationships may be of a different nature. Do we have a proliferation of consensual sex between teenagers, or is it a case of teenage boys actually raping teenage girls, which then results in the statutory rape accusation?